we are running through some stretches and releases through pregnancy and postnatally. These are great to do as well. Let me just adjust you just slightly to there. So pregnancy, postnatal are great, but as I say, you don't have to be pregnant and you don't have to be postnatal to do these. If you feel that you've got a little bit of lower back pain from overly sitting or sitting at a different workstation to what you have been maybe in the office. Obviously, we're in lockdown at the moment, so you'll be working from home and working at a different station, height of table, height of chair, maybe a different computer setup as well. So these things can have an effect on our posture. So for the pregnant clients, I'll do it side on actually, so you can see this a little bit better. These are seated and standing. So if you're pregnant or postnatal, then welcome. And welcome if you're not as well. Come towards the end of your seat and you want your feet to be flat on the floor and you want to be able to see your toes as well. So your sit bones are down. We're just going to go through a little bit of a pelvic tilt. So you're thinking about tucking the tailbone under just slightly and then bringing it back up. Okay, take a breath in when you're here. Exhale. And then inhale, sitting up nice and tall. Doing it again. Exhale, come down. So we're just moving through the pelvis a little bit, stretching into the lumbar spine. And then inhale as you come up. Obviously, the further on you are in pregnancy, you'll get a little bit less movement as you do this one. You can do this one also kneeling. And you can also do it standing if it's not comfortable on the chair. Okay. Doing it again. Exhale, coming down. And then inhale and come back up. Excellent. And again. And I'm going to turn this way just so you can see me in this direction. So you're going to just take one hand and reach it down and then bring it up and then down. So it's just a very slight move. Side bend to stretch one part of the lower back. Inhale as you're top and exhale as you're going down. Nice small movement. Good. Keeping that going. Inhale as you come up, then exhale as you lower and lifts. Excellent. And then let's go for one more. This time place the hands onto the thighs. Taking a breath in. Exhale, draw one elbow back. And then inhale, coming back to centre. Exhale, draw the opposite elbow back. And then coming forward. So you're kind of looking over the shoulder of the elbow that you're moving. Exhale, coming back. Just slide the hand along. Inhale as you come forward. So you're just getting a wee bit of rotation into the thoracic spine, into that mid part of the back. Now through pregnancy, especially in those later weeks, in those third trimester, this movement will be a wee bit more limited. And we don't want to overforce this move either. Exhale as you draw back and then inhale as you come forwards. Let's go for one more on each side. And then bringing it back into centre. Go for last one. Good. And then bringing it up. Now do this one over here. So the arms are coming up just about shoulder height and you've got your thumbs up towards the ceiling. You're just going to reach one hand forwards and then bringing it back and then the other hand forwards. So think about upper back tightness. Are you feeling some of that through pregnancy? We're more heavy loaded at the front with our bump and bigger boobs. So your posture can really be affected through that. Make sure you're sitting on the sit board. You can do this on your gym ball as well. And in that postnatal period, when you're humped over, is a technical term, you are flexed at the spine a lot. Your shoulders are rounded from picking baby up, changing nappies, feeding babies, no matter how you feed, expressing, anything like that that's going to cause a little bit of discomfort. And this is quite nice because it just moves into the shoulder blades and then you can make it a little bit smoother and going forwards and forwards. And it's a little seesaw action in between the shoulders, those muscles lengthening. Okay, and then relax there. Come up to, let's come up to stand. Use the back of your chair, or you can use the back of, you can use the wall. You're going to start with your feet a little bit wider than your hips. Sorry, just, there we go. So your feet are a wee bit wider than your hips. I'll show you in this direction here. So a wee bit wider, then you're going to turn the toes in towards each other to kind of open out into the hip a little bit more at the back and stretch into those hamstrings a wee bit more. Palms are facing up, taking a breath in. Exhale, come forwards and just lean onto that chair. And then inhale as you come back. Keeping the back nice and long. Exhale, so think about pushing your bum back, and it's as if you're closing a door with your bum. Lengthen through the spine. That's you. Exhale, coming forwards. If you want to try and activate through the pelvic floor as you are leaning forwards on that exhale, and then inhale as you're coming back up. Let's go for a couple more of those. So palms facing up. Exhale, coming forwards. Pushing the tailbone back as if you're closing the door behind you. Okay, let's go for one more of those. So exhale, coming through. This time we're going to stay in this position here. Taking the palms down and then just turn the toes to point forwards. Now, from there, pushing the hips back. So move, exhale, and then inhale. Exhale, push back. Then inhale, come forwards. You can do this on your knees with your hands on your gym ball, or you can do this with your hands against the wall as well. Let's go for one more. Then hold this one just about halfway. Take one hand across to the other, and you're just opening out one side of the body, so you're getting more stretch there. And if it feels nicer to push the hip back and lower a wee bit further, then do that as well. Just be in tune, just listen to the body. See how it feels. And then take your time coming up. Walk the hand over to the other side, there, and then draw backwards. That's it. Make sure, just hold nice and gently. Perfect, and then release. Take your time coming up, just stepping inwards, and we're going to go into, I'm just going to move that out of the way just now, to give you some more room. We're going to go into your T-step. So your foot here points forwards. This foot's going to turn and face the opposite way. Or it's going to make a T shape with the top of that foot. And then doing that again. So when we do this one in my Fit for Delivery course, the mums like this one. There, and then bringing it back. And then do one more. And then you can add the arms to reach and then come back through. Again, you're not forcing any of the moves. You're just gently reaching forwards and then coming back. Let's do that again. So step and reach. Kathleen is just saying she's not allowed to stretch. Somebody wants fed. The joy of the twins, Kathleen. And then let's start in centre again and move to the other side. So let's just leave the arms just now. So one foot, the toes are pointing forwards, and the other foot turns to go in the other direction, and you're making like a letter T. So imagine here with the feet, yeah, there, and then bringing it back. These are really good. So postnatally, lots of sitting through feeding twins, expressing for twins, breastfeeding or bottle feeding, it doesn't matter because you're still going to be sitting for prolonged periods of time. Go for a couple more. Exhale as you come forwards and then back in. If you've done Fit for Delivery, you'll recognise some of these. And then come back. Excellent. Let's take your chair again, or wall, whatever you want to hold on to, and then just step one foot back. So you're pressing the heel down towards the floor. We're going to go into a calf stretch. So you're lifting up and then down, up and then down. Heel up, heel down. And as you press the heel down, lift the toes just slightly forwards and then back. Now this time try and keep the body weight forwards, so you're not moving the shoulders forwards and back. They're going up and then down. Go for a couple more. If you're pregnant and you're getting leg cramps, maybe through the night, this could be a helpful one to do. Let's step in and then swap it over. So remember, it's two different moves. This time we're rocking it forwards and then we're pressing it down, yeah? As you press down, try and lift the toes on that foot behind you. So check my body weight just now. I'm moving it forwards and then I'm moving it back. just to get the ankle and the calf a little bit warmer. And then I'm going to keep that body weight forwards, and you'll feel more of a stretch in the calf. Up and then down. Up and then down. Also keeping that movement into the ankle joint. Lift and then lower. Go for a couple more. I've just got one more exercise for you, and then I'll let you be. Perfect, bring it through. So go back to that first leg again. Let the heel come off the floor. I want you to bend this knee almost like you're coming into lunge position, but it's a hip flexor release. So this side of your bum, squeeze it and push forwards. And you want to tuck the tailbone under so that you're lengthening into the front of the hip and you're lengthening into the quads. So through pregnancy, these muscles get really tight. Holding on for balance, obviously. If you can, go just slightly lower and feel that increase in the stretch. And just breathe as you're holding the position. And then slowly come up. Swap to the other side. So heel comes up, bending as if you're coming into lunge position, and then tuck the pelvis under. This way so you can see. Bending there and then tuck under and hold. So when we do this in Fit for Delivery, we quite often do it kneeling. But yeah, standing is fine. And also kneeling if you want to. It's more about the tuck. So here, you want to extend this area and this area down here. And then release off. Well done. Thank you very much for joining me, if you managed.